Sorry for the delay, super late with the answer for blood smear quiz number 8. This guy is a nucleated red blood cell. The other answer we saw a lot of is that it was a lymphocyte, and that is very common to think that that's what this is. They look really, really similar. So let's talk about how we know that this is a nucleated red blood cell and not a small lymphocyte. This is a small lymphocyte. See how it has almost no cytoplasm, very high nucleus to cytoplasm ratio. And that nucleus is not perfectly round. It's oval shape and often will have one side that's a little bit indented or a little bit flat. Here is another nucleated red blood cell. And this one is a little bit more obvious because it's a little bit more shifted to the right in the red blood cell lineage. And so you can imagine that if you pop that super round nucleus with that very dense chromatin, if you pop that nucleus out, it would look pretty similar to that red blood cell right next to it, right? It's pretty similar in size, and the color of that cytoplasm is a dead giveaway here. But not all nucleated red blood cells will have a cytoplasm that color. This is also a nucleated red blood cell. Now this cytoplasm is a little bit more purple. The cytoplasm of a lymphocyte is going to be a little bit more bluish, but you might be tempted to think that this is a lymphocyte. But again, that very dense chromatin in the nucleus and an extremely round nucleus, not that oval shape with one flat side that we saw with the small lymphocyte. And this more purplish color here, you could sort of imagine if you pop that nucleus out, this would look like a reticulocyte, which is what comes next in that in the red cell lineage. Here's another lymphocyte. Okay, this one does have a very round nucleus, but the size is what gives it away here. And see how the color of that cytoplasm is more bluish, and overall the cell is larger than the red blood cells nearby. So back to the original post, this is a reticulocyte here, and this is the nucleated red blood cell. And again, if you pop that nucleus out, it's going to look very similar to that retic. Nucleated red blood cells are a sign of pathology. It is not normal to see circulating nucleated red blood cells. You will see that in times of hematopoietic stress, so it's not necessarily an indication of a bone marrow problem. So you can see this in extremely ill patients in the hospital may start pumping out nucleated red blood cells. You see this commonly in sickle cell patients, especially when they are hospitalized for pain crisis or other complications. But if you see this in a patient with cancer, this could be concerning for cancer being in their bone marrow.